It's one of the most complex and urgent vaccination drives the nation has ever seen. The push to vaccinate First Nations people before Australia opens up. In vulnerable communities, vaccination rates remain critically low, even in Western New South Wales, where hundreds of Aboriginal people have COVID-19. As National Cabinet considers which specific vulnerable communities it'll target with the latest vaccination plan, local communities are working to combat hesitancy driven by misinformation and historical distrust in the health system and in politics. Joining me now, Dr. Janine Mohamed from the Lowitja Institute. Yuma, good afternoon to you.
Good afternoon, Dan.
I want to start, Dr. Mohamed, with the broad situation in remote Indigenous communities. What are you hearing?
Look, what we had at the very start was fantastic news. We were 6 times less likely to contract COVID, than non-Indigenous Australians, and some great work was done by our communities. Of course, the federal government identified us as a priority group early in the vaccination rollout, but from what we hear, there's a range of issues, including supply and demand and distribution issues. Communities did a whole heap of pandemic planning to protect communities. We heard of Marama Aboriginal Health Service there in Wilcannia, which now has tragically 1 in 10 people, affected by COVID. They warned the minister that there were issues such as overcrowding, highly mobile population, food security. There's no, Uber Eats in these sorts of communities, so people have to go off of community to be able to, buy their groceries. Low health literacy levels were all put on the table, but obviously they weren't. There wasn't enough planning done, and what we have is high rates in communities, particularly in New South Wales, where we see tragic numbers.
Yeah, and I want to stay with that community of Wilcannia just for a moment, Dr. Mohamed. 1 in 10 people with COVID-19 there. There's also the really serious question around infrastructure. But I wonder if there's also an issue there around this further entrenching distrust in public health officials or in the response more broadly.
Yeah, and that can't be underestimated. Historical truth-telling is such an important part of this process. I think now that we've all been in COVID, we can understand what it was like for many Aboriginal people, living on Indigenous missions that were established. History tells us there was medical experimentation done on, our communities, and that's still very relevant history for Aboriginal Torres Strait Islander peoples today. So what is trusted is Aboriginal community-controlled health services. And, there has been amazing work done, during the COVID pandemic by many of our Aboriginal community-controlled health service. I was really heartened to hear of, a fantastic story in Broome. They're holding a vaxathon, if you like, and that was by the Broome Aboriginal Medical Service. It kicked off yesterday, and they actually had their team deliver almost 500 COVID-19 vaccines in one day.
Yeah, which is incredible. And there are some really encouraging positive stories, including, I'm sure that you saw at the remote community of Maningrida in the Northern Territory. There was, I think you can only describe it as a vaccination blitz, the whole community getting together there with the health centre. This comes as we're seeing more and more detail, although it's slow, about the vaccination of Aboriginal and Torres Strait Islander people. In fact, in an e-bulletin that you've just put out, the Lowitja Institute, the Indigenous Affairs Minister Ken Wyatt saying 169,000 people had had their first dose, which is about 30% of those eligible, which is well below many parts, in fact, probably all states and territories. What's going on there with the vaccination rollout?
Well, I think you've already mentioned it, Dan. There's mistrust, there's lack of planning that's going on. There's vaccine hesitancy as well. So as much as there are Indigenous health leaders stepping out and, posting on social media their commitment to being vaccinated as individuals, there's also other leaders, within our communities that are spreading well, misinformation, and that needs to stop. And we just saw recently, religious leaders coming together to talk about their part historically, in mistreatment of Aboriginal and Torres Strait Islander peoples, and more recently, some religious groups actually spreading mistrust in the vaccine as well. So it all comes together in us taking, stepping out and doing our part.
On that, Dr. Mohamed, what do you say to those people that are peddling mistruths and misinformation, fake news, if you will, in remote Indigenous communities in particular?
Probably quite a strong message, which is we know what's best for our communities, and leave it to us.
What's been the role of the Lowitja Institute in framing, I guess, the communication and that first and immediate health response?
Yeah, so we worked with the National Aboriginal Community Controlled Health Organisation, or NACCHO, to do some rapid reviews so that our health services had the most up-to-date information. We've also called on a number of, what we would like responses. So we really, at the moment, need data, to actually be out there in the news telling us where we're up to for our mob anyway, where we're up to in being vaccinated. And we also need modelling for our communities. So what we have at the moment are, the whole of Australia type of modelling, and we have the whole of Australia data. But what we're interested in, what we need, is Indigenous data and Indigenous modelling for our communities.
And I wonder if there are specific strategic and communication responses that are unique for Aboriginal and Torres Strait Islander communities that should be being put in place, or at least being developed now.
Yeah, look, June Oscar said in the Close the Gap report, when you have Aboriginal and Torres Strait Islander people in the driving seat, when it's place-based, that's when you see what we saw at the beginning of COVID, which is we're 6 times less likely. So that just needs to continue, and it needs to be place-based. It needs to be done with communities. Equity is about meeting people where they're at and giving people what they need, not treating everyone the same. And I think, that would be a great response to the whole of Australia.
We've been hearing from strong Indigenous community leaders like yourself, like June Oscar that you just mentioned, Pat Turner, the head of NACCHO as well. Are you happy with the leadership that you're seeing from our political leaders around the country?
Am I happy with it? Well, I'm not happy with what we're seeing in New South Wales at the moment, which is these tragic numbers. And, as I said at the onset, we need a stronger vaccination rollout to Aboriginal and Torres Strait Islander peoples everywhere. And it needs to be led by Aboriginal and Torres Strait Islander peoples. So I think it's time to listen and to build upon the fantastic start that we had at the beginning. And we know why we had that, that amazing start to the COVID response from our communities.
Yeah, and look, just finally, Dr. Mohamed, what do you say to Aboriginal and Torres Strait Islander members of the community, members of other minority groups as well, who might be hearing you but still feeling a little bit concerned, unsure about the vaccine and the broader rollout?
Well, I'm a nurse by trade, and I trust my medical health professionals. So I believe in pre, prior and informed consent. And I think everyone needs to get that information for themselves and to make informed decisions, on the premise of we as Indigenous peoples across this land, it's about caring for community and community at the centre of everything. So with that at the forefront, I think we all know what we need to do.
Yeah, great advice. Thank you so much for making time to have a chat. I know how busy you are with being very much at the forefront of this strategic response. Dr. Janine Mohamed from the Lowitja Institute, great to have you on.
Thank you, Dan.